Good evening and welcome to tonight's Power Hour. I am Jenny, a sport therapist at the Hatfield and St Albans clinics, and I'm joined by Maud and Sophie. They are osteopaths in the Cambridge and St Albans clinics, and today we're going to talk to you about gym injuries. So obviously the gyms have been opening since the period of lockdown, and a lot of people are getting back into going back to the gym and lifting weights, cycling, swimming, and maybe those that have never gone to the gym before, starting going to the gym. So this is really for you guys, just to know what injuries to look out for, signs and symptoms, and how to maybe stop those injuries from happening.
So we're going to talk about kind of the most common areas and types of pain that people can get once they start going to the gym again after a long period of rest and of not training. And I think we can start with one of the most obvious one, which is kind of delayed muscle soreness, isn't it? Kind of the muscle soreness that you get after really hard workouts that you're doing at the gym or at home, actually.
Yeah, so it's called delayed onset muscle soreness, and a lot of people know it as DOMS, and it lasts kind of between 24 to 48 hours post exercise. Sophie, so DOMS is like about the breakdown of the muscle fibers, isn't it, when you're working out?
So when you exercise, what you do is you actually wear down some of the muscle fibers, and then your body builds them up again. That's how you get bigger, bulkier, stronger muscles, is that you break it down and then you build it up again. And that breakdown can actually cause a little bit of discomfort. It shouldn't be really acute pain. We're not after something that's really quite sharp or not being able to move your body. That's something a little bit more serious. DOMS is just that soreness after you've done a intense workout, or if you haven't exercised for a while, pretty normal for you to do after that, but because your body's not used to doing that.
Yeah, usually it shouldn't be that painful. I remember a couple of times when I had DOMS really, really painful, and I think that's when you can gauge actually you might have done a little bit too much on your workout, and you can be careful on next time. Just take it a step down, just because you don't want to do that all the time and then create injuries afterwards. So it's about gauging how much you can do and how much your muscle can take as well. You don't want to tear any fibers from your muscle. You don't want to do it.
Yeah, I think if you're struggling with DOMS, then massage can help, like in the short term, like a massage recovery, like self-massage or maybe booking in. But I think if the pain is lasting a lot longer than 48 hours, and usually it's like a kind of targeted pain to a specific area, then potentially you might have actually injured yourself rather than it just being the soreness. Usually the soreness is like widespread over kind of the whole muscle area that you've been working. And it's like, let's say you've done a leg day, it usually is like standing up, sitting down, you'll feel it, but kind of walking around, it wears off. Yeah. But if it's kind of something that's lasting a bit longer and it's more kind of pinpointed to an area and like specifically, then you most likely have probably injured that area. So it'll be worth getting checked out. But usually, as Maud said, it's more if you've really overloaded your body. So a good kind of starting point, especially if you've not been to the gym before, or if you've maybe not been for a long time, is taking down your weights or starting at a lower weight than what you were previously, and then kind of seeing how your body reacts afterwards and slowly then increasing your weights.
Yeah, and I think as well is thinking it doesn't have to always be painful after a workout. I think some people think, oh, if I'm not sore after a workout, it means that I haven't worked enough and I haven't done enough. I think sometimes a little bit too much. You don't want to always be painful. Sometimes a really good workout doesn't have to give you DOMS afterwards.
No. Yeah, I think that's the difference between like a strength workout and like a aerobic workout, isn't it, really? I think if you're constantly looking to build your muscles, then potentially, but again, it's maybe not healthy all the time. So maybe it might be good to do like 1 or 2 strength training a week, and then if you want to do a third one, because a lot of people like going 3 times a week, maybe do more like a CV workout or something, or stretching, or
yeah, definitely. What would be worried about is if you're particularly overloading one group of muscles. So if your dream is to get really doing bicep day after day after day, what will be you sustain bicep in and the muscle itself to the 10, or perhaps even giving yourself a bicep. So just because that doesn't mean it's a good thing, but it also means it's a bad thing.
Yeah, I think it's just making sure that you give yourself enough recovery days in between, isn't it? A lot of people break up their muscle groups for the training program. So as you say, like not going like Monday and doing biceps, Tuesday doing biceps, Wednesday doing biceps, like maybe just doing like biceps and I don't know, triceps or upper back or something one day. Have your period of rest, allow your body to recover because it's going to be sore with your DOMs. And then kind of probably just doing it once a week and then doing other muscle groups throughout the week until you can do it again the start of the following week.
That's when you're injuries as well, isn't it? If you're still having DOMs, your muscle is still recovering, and then you're even overloading it and working even more on it. That's when you might be too much for that muscle. So you need to allow the nice rest period for that muscle to recover, to become healthy again, and then you can overload it again and continue your training.
Yeah.
I mean,
I think a good way to prevent, or try to decrease DOMs, so muscle soreness, will be a good warm-up, cool-down and stretching. Making sure, so DOMs is where you've got a build-up of this fluid called lactic acid, which isn't overly healthy if there's a lot of it in the area. So that's what DOMs is. You've got a lot of lactic acid build-up. So if you do a cool-down, get your heart rate lowered, stretch out, then hopefully that tries to remove some of this acid away so you won't be as sore afterwards. And obviously, as mentioned before, maybe some massage or stretching.
I encourage my patients, when you come back from the gym, have a shower because they're a bit hot and sweaty anyway. Just when you're in the shower and you're lathering, give yourself a bit of TLC in the evening, make you feel a lot better. Normally the day after, and it's quite nice to give yourself a little bit.
Yeah, and hot baths and stuff, as you say, hot shower, hot baths. Do you girls have like any information on Epsom salts? Do you know much about Epsom salts?
Not that much, but I've had a lot of patients are using it, and they said that they really get some relief from it.
A lot of patients find that magnesium actually helps them with recovery. So either magnesium in the bath or pills, creams, or even just taking it. But again, if you have any health concerns in that regard, I would consult about taking it.
Yeah, before you take them. Okay, so that is, I'll probably say that's like the most common thing that everyone who is starting to exercise will definitely experience.
Yeah, definitely. I think one other thing that a lot of people get is problem in their shoulders, actually. When we talk about a problem with muscles around the shoulder, we call them kind of the rotator cuff muscles. You can get problem with any of these. And that's usually if you have pulled a weight a bit wrongly, wrong position, or it was really too heavy for you after a long period of rest. Also from swimming, actually, after swimming for a while, there's a lot of shoulder movement with swimming, which can irritate a bit some of your muscles around your shoulders. I'm seeing quite a lot of shoulders at the moment, showing that people are overworking it at the gym with their biceps.
Yeah, I've seen quite a lot of shoulder injuries recently, and actually it's people who are so happy going back to the gym and they've not been or just done like a basic home workout for the period of lockdown. So they've gone back to going, I don't know, doing 30 kg presses which was the exact same what they were doing pre-lockdown. But obviously the body has changed since you last went into the gym. So usually with the shoulders, and there's a specific rotator cuff muscle in particular, which usually is the one that gets a bit unhappy, the supraspinatus. Usually it's more to do with like overhead press work or overhead kind of weightlifting techniques. And it can be due to maybe poor technique. But most of the time it is because of the load that you do. As you were saying, Maud, it's a lot of these rotator cuff muscles, but muscles turn into tendons, which attach into your bone. So quite a lot of the time with the shoulder, the tendons aren't very happy with the exercise that you're doing. Tendons like to have a nice steady load that they can adapt and get stronger, kind of like muscles, like it adapts, it gets stronger. And quite a lot of people go too heavy, too fast, and it kind of throws the tendon off, and that's what usually gets injured when we're kind of talking about the shoulder area. It's more tendon. I think that's what I see a lot of anyway, like a tendon injury. What about you, Soph?
Yeah. I think the majority of my patients are in fact shoulder patients rather than anything. It's really easy to just irritate. But also something I've noticed is a lot of people have obviously their ergonomics or their workstation work from home, or they haven't been working furloughed. But you have a steady desk-based job and you're in this normally every day, and then that there is incorporation of that's going to really affect having been in this position. Body's put you in this such a long period of time and have quite a sudden change in the body's to that, and to then go back to the gym and load it back to your pre-lockdown body or weight or whatever you it can really affect
what I'm seeing with that posture as well, with people working from home, is they tend to keep their shoulder quite forward. So when you're at the desk, you're like this, closing up the front of your shoulders, where you have your pectoral muscles become very tight and shortened, with, as Sophie said, completely change how you move in your arm, and then it's going to change how much range you have in your shoulder to be able to push that weight. So that's what with the treatment and with going to see us, we can really try to release all of this area to try and get you back to the full potential and the full function of your shoulder, and then advise you on how quickly and how grade by grade you can go up in weight within your training, taking the time to load those tendons instead of just suddenly asking them to do something that you haven't done for months.
Yeah.
It's pretty normal for your shoulder movement. It's been a pretty really muscle groups quite hard.
I think you dropped out a bit there, so.
Yeah, you're breaking up a little bit, Sophie.
Maybe move the phone a bit to uncover the mic.
Is that better?
Yeah.
Like that?
I think so, yeah. Technology, eh?
Good.
Yeah, I think the point is, as you were saying, we're kind of really loading it day to day by having this forward posture, then loading it in the gym. A really good exercise actually is to really stretch through like this front of the pec, is maybe have yourself up against a wall with your arm flat against the wall, and then just turn yourself outward. So you should feel a nice stretch coming through your pecs. And that's quite good anyway if you're just office-based and hunched over in your desk. But definitely maybe something to add into warm-ups. If you've just come straight from work, go into the gym, which a lot of people do, just to really try and open everything back out. And therefore get yourself in a good position to start loading through the upper body.
And I think it's what you mentioned before is a warm-up as well at the beginning. So you always want to get some blood within the muscle and the tendons before you starting loading them and really doing some heavy weights on them, because they need to be able to adapt. And when you go on the cold muscles that hasn't been moved in a while, that you've been in the same position for a while, it's going to be a bit stiff starting with. And when your muscle's stiff, that's when you're going to get more of the injuries rather than when they're warmed up and the blood is flowing and everything is kind of active.
Yeah. Perfect.
Yeah.
So yeah, any niggly shoulders, don't just leave them not looked at, because it's kind of shoulders. I mean, shoulders are a bit of a nightmare sometimes. They can take a little bit long to recover. So usually, I mean, in my experience anyway, usually it's if something doesn't feel right, if you've been going to the gym and lifting overhead, if it's not that DOM, so it's past kind of the 48-hour mark and you're still really struggling, then I would definitely try and get it looked at sooner rather than later, because shoulders can niggle on for, well, as I say, I've seen quite a lot of patients where it's niggled on for a good couple of weeks.
Yeah, rather than kind of pushing through it and
really and continuing to load it
more. Yeah. So
there was a recent study that came out that suggested even with treatment, it can take 9 weeks of treatment with a reduction in exercise before you start to not feel the same amount of pain. And that's not getting rid of the pain entirely. That's just a reduction in the amount of pain. And that's 9 weeks. So it can take a long recovery. So it's much better for you to just warm up, warm down, foam roll when you need to, have a massage when you need to, rather than have, 9 weeks plus of treatment and pain. And
and off the gym, obviously. And that's what everyone wants. Everyone wants to be back in the gym, exercising, getting rid of the weight that they put on during lockdown. But yeah, unfortunately, for some reason, shoulders are just take a long time to recover.
Yeah. Then if we work down the body, I think I'd say the next area really common for people, which is the most common area that I think I actually see, and potentially you, but it's also a very weak area when you go in working out. It's the lower back, so what we call the lumbar spine, which is just a segment of 5 vertebrae on your lower back, then going into your sacrum and your tailbone. Really common area to get injured in general when you just most of the thing is lifting something heavy and people start feeling a twinge in their back, feeling lots of pain, and then starting to struggle to do other exercises. And then at the gym, it would be again squatting, things like that with weight, so getting that pain in the back, so poor technique as well.
I think being a sport therapist, I see quite a lot of the gym goers coming in with their injuries, and I would say the most common thing as to why their lower back is sore, apart from maybe lifting something really heavy and kind of their back going, is probably technique. So when you kind of delve deeper, it's, I'm doing a lot of squatting, I'm doing a lot of deadlifting, or I'm doing a lot of kind of powerlifting, so like cleans and things like that. And observing the technique that they do, it maybe is loading through their back too much. The back shouldn't be involved really. That's all kind of predominantly leg-based work. Apart from obviously deadlift, unless you're doing a stiff leg deadlift. But for all of those exercises, what really should be happening is your lower back needs to be nice and straight and stable. You shouldn't be having a bend in your spine at all, because then you're loading through that lower part of your back and you're going to cause an injury. So it's a difficult one with how to correct yourself. Maybe have a look at some YouTube videos, maybe comment below if you are concerned about your technique, and we can maybe have a chat and get some videos going to see if things need to be changed. Obviously, personal trainers are great in the gym, but also I just find looking in the mirror in a gym is like really, really helpful. A lot of people don't do that, and it provides you with so much feedback on positioning of things, and I think that's key. It's key to get your technique, particularly with the weightlifting side of it.
Would you say as well, try and work through the stabilizer of the core and things like that to try and protect a little bit the lower back? So as you're using those, like you're lifting with heavy weight, you're engaging the abdominals, your core, instead of having the load kind of going all through the spine and the lower back.
Yeah, I think kind of the society in general, everyone I would say probably has quite a weak core. And like, we're not talking about like nice ripped six pack. We're talking about like the deep stabilization muscles around your like spine and stuff. So yeah, a lot of people tend to overload their lower back because they don't have those muscles in the core. So definitely that's a really good prevention thing if you want to really increase the strength in your lower back, and if you are looking at doing more high strength training or power training, then look at doing some nice deep core stability exercises. So that'll be the stuff like your Pilates and your pelvic floor work. And there's loads of different stuff out there for Pilates, but that's a great prevention thing. But I think a lot of lumbar spine problems can be caused in the gym from like treadmills as well. It may not always be related to weight. Have you seen any of those, Sophie? I think I've had quite a few.
Yeah, I've had a few runners, definitely, who've come in because of their lumbar spine is giving them a bit of jip. So it can be that it's like you said before, it's quite a weak area generally because people don't tend to use that area. So we are predominantly a sitting based people. You know, we sit down all day, we sit down when we commute to work, we sit down at work, and then we sit down on our way home from work, and then we decide, I'm going to get really active, and I'm going to go to the gym, and I'm going to run on the treadmill for half an hour. And there is just not that stability going through their sacrum, their hips, their lumbar spine to just do all of that movement after they've been so stagnant and still for so long. That's not to say if you're an avid runner, you love running, you're a really keen runner, then by all means do continue. But you're going to want to build up those muscles that are surrounding through your hips, your lower back, your core, so that you can stabilize yourself through that sacrum. But also just work up to it as well, not just go like, I think running's a really good exercise, so I'm just going to run until I can't anymore.
Yeah, I think also a big thing, sorry Maud, I think a big thing is impact as well. So there's a lot of talk about surface that you run on, so kind of trail running, road running, treadmill running. And I think if you are a first time runner, a lot of people try it out first on a treadmill in the gym, and that's very, very high impact. So that's a lot of kind of load and compression going through all of the joints in your spine. And maybe if there is a kind of underlying issue that you wasn't aware of, or if you're weak, or maybe it could be something as simple as like a biomechanical issue, so maybe flat feet, not wearing the right trainers, then all of that can affect kind of all of the load going through your lower back. So again, I think it is great to have the correct core stability, but I think the same kind of applies with running as it does with strength work, starting low and then building yourself up for obviously the impact part of it.
I think an important thing as well is stretching, actually. So especially people that are sitting, like you were saying, Sophie, the whole day, you're getting what we call your hip flexors very short and tightened because you're in that position with your hip bent the whole day. So they start getting shorter and shorter. So you're losing that mobility in your hip where you can put your leg back. It's actually a very important movement for running and for the mobility through your hip. So that's something really important that you need to stretch to being able to go to your full potential within running and to really use your joint mobility. Because if your hips are not moving too well, there's going to be other parts of your body and really your lower back that's going to compensate for the fact that that hip is not actually performing as best as it can be. So there's a lot of factors. So we talk about a lot of things, but the best thing to do is probably listen to my video to help you, but also to see one of us or a sport therapist, a PT, anyone that can help you have a look at how you do these things and then give you the best advice depending on your body, because we're all different. Everyone's going to have different problems and different loading and different muscles.
I feel like we're just going like a full circle back round to warm up and stretch, isn't it? Warm up and stretch.
Yeah, and seek for advice and help you if you need to, and if you feel like there's a niggle, don't like often just go away. But if you keep on pushing, it might just go a little bit further, and you might just be out for weeks, for months, which is not what
Yeah.
you want to do. So sometimes it's about prevention as well. Looking at before the injury, what can you do better in your training? How can you perform better where you are now before injury rather than going through injury and then go again through the circle. So yeah.
Perfect. Yeah, that's good.
Yeah. No, whenever I see anyone with low back pain, I always treat through that hip flexor. People always think it's a bit strange through the area go up.
Yeah.
People always think
Yeah.
it's a bit strange when you're treating in that area when you go, oh, I've got a back problem. But you can get some really quite serious symptoms, and you can get quite scary for some of the patients to go, oh, I've got this, I've got that. It is just one muscle is just got so tight. So it's better to see someone before rather than after.
Yeah, definitely.
So then I think we can go to the next one.
Yeah.
With Jenny, we're talking of knee pain, especially at the front of the knee, where we tackle the patella. The patella is the little bone that's deep at the front of the knee that people sometimes move.
Yeah.
That's quite a common thing, and especially for people at the gym that are doing lots of leg motions, so squats, anything like that, using the front muscles, so the thigh muscles at the front, which are the quadriceps.
Yeah, so I see so much of this. We kind of class this as like an anterior knee pain. So anterior meaning the front, so front of the knee pain. And usually it's to do with how your kneecap is moving. And that can be what I usually find anyway. It's because of maybe a muscle imbalance through your quad, so through the top of your thigh. A lot of people that go to the gym decide, let's say you've just started at the gym, they decide, oh, I want to start squatting. And maybe because squats are what everyone wants to do, or lunges. And actually maybe your muscles need to be worked individually before you start doing a more kind of big compound movement that involves your whole body, because then that can start loading through the muscles and through your knee in a certain way, which then will make your kneecap maybe track differently and therefore cause you pain. So if, let's say, you're outside of your leg, the muscle throughout the outside of your leg called your vastus lateralis, if that is really, really tight, and your inside muscle in your quad, so your vastus medialis, is really loose, anytime you bend your knee and do an exercise, so you're squatting, your kneecap is going to be pulled outwards, and that's not good. So usually what's good is maybe start on some simpler exercises which isolate those muscles. So maybe just some seated like leg extensions, or maybe some like ball squeezes to really work the inside of your legs. And when you've kind of built up that muscle to a good level individually, then you can maybe start doing some more compound kind of full body movements like your squats and your lunges. Otherwise, I find people load the knee too much and it can't cope with it, and the kneecap's moving everywhere and they're getting loads of pain and swelling to the front of the knee. Yeah. That's what I find anyway with that.
It's being careful as well, I think, to keep your knees straight and to not kind of collapse inward within your knee. So it's a very important thing to do whilst you're squatting. So same thing as with the back and the weight training. Look at yourself in the mirror, look at your knees and try to keep that very straight rather than having your knees kind of wobbling everywhere. And that's if you're not strong enough, you're going to tend to kind of wobble a little bit. To get the strength and keep those knees really straight. I can sometimes help with that band, an elastic band that gives you some resistance on the outside of the knee to keep that slight pressure outwards instead of coming inwards with your knees. So that can help as well. That's something to be wary of and careful when you're squatting a lot.
Yeah. It's the same as, lots of people quite like the look of having that quite nice quad definition on their leg. And so they do exercises so that they can get that look. But that doesn't mean that functionally is actually the best way of having it. If you do one thing to one side, you want to do it to the other side as well. So if you're really training the outside of your leg, you want to train the inside of your leg as well, just because structurally that's how your body works best. So you don't want to just, you know, work out in the gym so you can just have one look. I know some people do, but long term that won't necessarily be the best for your body.
Yeah, and it's doing it as an overall. So it's same with front to back, isn't it? If you do the quads, don't forget your hamstring at the back. And you need to balance your body. And if you constantly do one front of the body or side of the body, it's just gonna tighten and you're gonna create imbalance and weakness on other parts of the body.
Yeah. So with the anterior knee pain, usually the symptoms are like pain to the front of the knee, under the kneecap. Some people can't actually feel the pain when they touch it because it's kind of deep under their kneecap. And usually it's with any sort of knee bending exercises that you can't do because it's painful. So your squats, usually it's like getting up from sitting down. Sometimes people feel a bit sore. The common one that I get for like your everyday people is like using the clutch in the car. So if you are experiencing any of those symptoms, maybe have a little look at your exercises that you're doing. Maybe make sure, as Maud said, that you're doing the actual exercise properly. Your knees are coming down nice and straight and they're not collapsing in or out. And if you're still struggling, then maybe you need to come in and get some rehab to make sure that your muscles are balanced through the upper part of your leg. That's what I would say.
And the next thing I think for knee pain is being careful that it's not something a little bit more serious, because anterior knee pain like that, if it's just from kind of muscles and overloading or things like that, it's not too difficult to get that sorted, and it's all good. There's lots of things that you can do. If it's something a bit more serious that involves your ligament or your meniscus, which is the joint just in between the two bones of your knees. That's something that you need to be a bit more careful when you're doing exercise, and you need to strengthen things to make sure that you're not further injuring that area in your body.
Yeah, and I think as well, a lot of people think, I've got this pain, but I'll give it a week or two and let's see if it goes. Now I'm going to load it again. And they load it again, and maybe it's a little bit niggly, and they just keep with that cycle, which one isn't good for you kind of mentally. Like getting back to the gym, you're not going to be able to put your all into it. But physically, you might have started with a bit of this anterior knee pain with your kneecap not moving properly, but then you're probably not loading your body correctly because you're in a bit of pain when you come down into a squat. So then what you'll find is you'll start getting problems further up the body or further down the body where you're loading differently. So I think, yes, maybe delay muscle soreness, fine, if it goes away. If you're noticing that you have something niggling away every time you do certain movements, then it's probably worth not leaving it, because if you leave it, it's going to turn into something a lot worse and something which is going to take a lot longer. And ultimately, people want to be in the gym working out, and not in our treatment rooms, not being able to do anything. So.
And how often have you guys heard, well, I had this one problem and then that went away and now I've got this other problem? And it's because they've had an injury before which they haven't allowed to fully heal, or it's taken so long to heal that they've actually had to alter their gait, they've had to alter how they move, they've had to alter how they sit, etc., etc. And so now it's gone, like you said, Jenny, up or down. You know, they're now getting that pain. It was in their knee, but now it's really in their hip and in their lower back. And so rather than just coming in to see us so that we can sort out one problem, we're now having to sort out the entire left side of your body, you know, so having to work through the back, the foot, the ankle, the knee, the hip, the quads, the hamstrings.
It can actually all the way up to your neck as well, you know, like you can really travel through the body all the way up to neck pain. So
yeah, it does. That kind of leads on, I think, to our last injury, also to do with the knee, again, with kind of loading a bit too much. A lot of people have heard of the IT band, so your iliotibial band. It is kind of a thick layer of fascia, which is on the outside of your leg. And particularly, so we've talked quite a lot about kind of weights and gym and runners on treadmills and a little bit on swimmer injuries with the shoulder. But this usually is something that is found in the cyclists more, runners and cyclists. Have any of you guys had any experience with ITB?
Yeah, I've had one patient in particular where it was so agonizing for them. They were just getting shooting pains all down their IT band constantly. It can get pretty severe and quite painful. And when it gets to that level, it actually takes so long in treatment to try and reduce that tone, to try and get it feeling just a little bit better so the person can have normal function. So you've got to treat, sometimes you can't even treat on the IT band itself because it's so tender, so you've got to try and treat surrounding tissues. It does come off of the glutes, so it comes off that glute medius, glute max. So that's why cyclists, they can get it a lot because they're using those muscle groups quite a lot. Treating through the hamstrings and the quads. But one of the best ones I've found with most of my patients is just trying to get them to foam roll it themselves at home. So if you are a real avid cyclist, foam rolling after you've been out cycling, and not just it's a bit sore, so I just go up and down it once or twice. That's not really doing enough. And if it is really that sore, then I would suggest you either foam roll against a wall, so you have the foam roller against the wall, so you can dictate how much pressure you want to put against it if it is that tender, or even just using something like a tennis ball or a massage ball on the area against a wall, rather than putting your whole body weight just on that one tissue. It's pretty intense.
It's quite a tender area anyway. Like if everyone kind of feels through the outside of the leg, it's not the most comfortable. It is a little bit tender anyway. So like foam rolling is not the nicest place, but it is kind of one of the best things for it. I mean, we should probably have said the ITB, so iliotibial band, comes all the way down and it attaches right onto the outside of your knee. So usually it's found in the cyclists or runners because of the repetitive as Sophie said, use of the glutes, but also because of the repetitive like bending and straightening of the knee. So what happens is that IT band comes over the side of the knee. Every time you bend and straighten, that IT band is kind of going over your bone. So it's kind of rubbing and providing a bit of friction. And I think it's more just about, again, going back to load, making sure that you're not going crazy with the amount of load so that the kind of IT band can adapt to what you're doing. But again, it's also going back to stretching and warm-ups and cool downs and making sure that you're biomechanically in a good kind of position with your body. Your glutes are strong enough to kind of support down through that area. But a lot of people can actually just get pain coming down through the whole band itself on the outside of the leg. But I've had quite a lot of people where they just kind of have pinpoint pain kind of right on the outside of the knee. And a lot of people worry that they've like done their cartilage or done a ligament. And actually, when you kind of look a bit more into it, it is this band just being really tight and like pulling on that outside of the knee. Were you saying that you've had that as well, Maud? Like a lot of people with those symptoms?
Yeah, I've had more of like that pinpoint things when you're looking a little bit further. So you're doing all of the tests for the other injuries and you're finding that those are fine. And then you're finding that it's actually from a bit more soft tissue problems. So you're having that friction and then repetitive bending of the legs, creating that tenderness every time they go out or after big cycles and things like that. It starts to inflame this area and be them. But yeah, it's quite a common one, so have a look out for it if you are a big cyclist or runner. If you feel like you're having it, don't hesitate to see sport massage and osteo physio and buy that foam roller to try and get to work through it.
And I think quite a lot of people are shocked when because everyone's heard of the IT band or the ITB band or the iliotibial band, however everyone says it, but not many people don't realize that it's not a muscle. Lots of people just think it's a muscle, and then they're shocked that the IT band doesn't respond the same way a muscle does to treatment. So if you've got a quad problem and you have an IT band problem, they're going to respond differently, even if you do the same treatment. Even if you massage both of them, they're going to respond differently because the IT band just isn't a muscle. It will take longer to actually work through it just because of the structure of it. And if you're going to buy, I would say if you've got a really, really acute foam roller, don't buy one of those massive, like really rigid foam rollers, you know, that made up like
the divots in it as well.
Yeah. With the divots and the dimples, and then lying on the whole thing, and then lying and going up and down it. You'll cry.
It'll be an agony.
It will be agonizing. Buy one of those things. It almost looks like one of those swimming pool noodle things. Buy one of those and start on that. That's got enough give on it so that it's not too much pressure, but it is providing enough of that sort of soft tissue effect.
Yeah, that's a good point. A lot of people like to just use the divots and the hard ones, and that's fine for like muscle groups because, as you say, the muscle's got quite a lot of give and stretch in it anyway, so it's usually okay. But the IT band being a kind of big, thick piece of fascia, you're going to struggle. It's going to be very, very good.
Yeah, and then you just don't want to do it.
It needs to be done.
Yeah.
If you are suffering with it, but yeah, it's one of those that you might have to clench your teeth a little bit, I think. And I think just on that point that we're talking about muscles and fascia, obviously just to note, the very last thing that we're going to talk about very quickly is just generic muscle strains. So overloading something, doing a explosive movement can cause a muscle strain, and there are 3 types of muscle strains depending, like going up in severity. So I think it kind of relates back to our first point on DOMS. If you're noticing that actually post kind of 48 hours you're still really struggling with your muscle, then I would always probably be aware of at least a small strain going on. I mean, I've loads of people, particularly with kind of the legs, and in particular calves. Calves are quite a common one that people strain like with an explosive movement. I think, Sophie, you've seen a muscle strain today, haven't you? Quite an acute.
Yeah. So I had an emergency patient come in complaining of a very acute calf injury. The patient couldn't even walk properly. And that's when you begin to worry that they've actually got a muscle tear, possibly, or they have some kind of ligament damage, which is a bit more serious. You know, if you've got DOMS, you do not want to be limping and hobbling. Sometimes it can be a bit difficult for you to sort of jump up and down stairs if you've got DOMS. But, you know, it shouldn't be agonizing for you to just stand on it. And then if you've got any kind of bruising, any kind of unknown bruising to an area, you know, you've been doing some exercises and then you go, oh, I've got a really dark purple bruise on the back of my calf and it really, really hurts. And that's not DOMS, and that's something a little bit more serious, like a muscle tear.
Yeah, I think a lot of people, I don't know what you girls, again, like I get quite a lot of these sporting muscle tears. But a lot of people just think that, oh, I've got maybe just like DOMS or just a small little tear. I'll just leave it and it will recover in a few weeks' time, maybe 2 weeks' time. And then I'll go straight back to the gym and load it exactly how I did before. And the problem with that is when you tear your muscle, you're tearing the fibers that make up the structure of that muscle. So in order for it to recover, you need to have rehab on it. Loads of people don't have the adequate rehab for their injuries. Or don't do any at all. So if you're going to go straight back to where you were kind of weight-wise before, it's just going to flare it all back up again. So it's just making sure that you start off with a really basic kind of exercise, obviously after you're doing like your rest, ice, compression, elevation, if it's that bad, and then kind of progressing through with the strength again.
We were talking about grades, weren't you? So the intensity. So we talk about grade 1, grade 2, and grade 3. So if you start with a grade 1 with that little niggle, and then you're like, okay, I'll just like leave it for a couple of weeks and then start again, exactly as you said, the same way, you might just go up in intensity and in grades the longer you leave it and the more you train it. and you might end up like month after by just having continued overloading it, having a full grade 3, which is like a complete tear of the fibers, which is really not nice and good. So it's really taking it easy. Take the time off if you need to, because it's very important to rest and to let your body heal in its own time, and then go back even stronger afterwards.
And it's an adequate rehab afterwards is pretty important, because you want the muscle to act how it did before the injury. Because what you don't want to happen is sometimes when these tears heal up, they'll heal kind of like this, and they'll shrink and they'll get tighter and smaller and shorter. And so you can see some people when they're walking, if they've had like something like a calf tear, that they can't really take their ankle all the way that it would normally. They can't press down as much as it would before. So they've physically lost that movement in their calf. And calves especially they can be a bit temperamental when it comes to tears. They can be fine, and then they can be very not fine quite quickly.
It's such a key muscle though, isn't it, for walking and everything. I think that's why
it's really frustrating for patients. Really, really frustrating.
Yeah. But I think just on that point that you were saying, Sophie, that you're reduced in range, you're reducing your movement, and that kind of links back to what we were saying before about how if you then do start going back to doing the exercise exactly how you were before you were injured without the right rehab, then you're going to be loading differently because you've not got a full range, and then you're going to be starting to affect other things in your body, other muscles, maybe joints.
It's a chain reaction.
Yeah, I think that's the big take home for this. Yes, you have all these common injuries that are associated with running, cycling, swimming, strength work, but I think the main points are making sure that you are warming up, cooling down, making sure that if it is not DOMS because it's very, very painful, or it's lasted 48 hours, that you shouldn't probably reload it until maybe you've got it checked out. But also I think the key is not leaving these niggles, not leaving all of these little niggles going on and on and on, because as Maud said, it can cause further problems with that particular injury. Or as Sophie said, it can then start causing problems elsewhere in your body. And I think we all know, we've all gone to the gym, we all do exercise. Everyone wants to be in the gym. Everyone wants to not be injured. They want to be in the gym. They want to be lifting. They want to be seeing gains. And I think the way to do that is to just be sensible, to make sure you're loading correctly, and to make sure that if you do have a niggle, to get it sorted so that you're only out maybe for a week or two, or maybe obviously depending on the severity, rather than leaving it and then being out for a month or 2 months. I mean, I don't know if you agree, girls, but I think that's the big kind of take-home message from today.
That was a really good recap. I think I'd add one thing. I think as well, listen to your body. So in general, your body is going to tell you when you're overdoing it. That's its way of telling you, okay, no, you did too hard on that. That was too much. I didn't like that movement. It's your body kind of telling you that's not okay. So just just listen to that, and it will guide you where you need to be, and then.
Yeah, definitely. And variety is the spice of life. If you just love doing weights and weights and weights and weights, that's fine. But if your body is too sore to do it, go out and try something new, try something different. You might be surprised and actually find that you enjoy it. You don't want to just overwork one muscle. Everyone's had that time in the gym where they go, oh no, I've gone far too far this time. I'm
going to be sore in the morning.
Yeah, you're getting out of bed and you're like, oh no, this is agony. And, who wants to feel like that? Because then you've got to go throughout your whole day feeling miserable, and then you go, well, I can't go to the gym today. And then the next day, oh, I'm still not feeling going up for the gym. And then you can't. Some people, the gym is their escape, and they can't do that, 4 sessions a week that they love doing, because they've just gone a bit too far when they were there before.
Yeah. So yeah, thank you for joining us for tonight's Power Hour. If this has kind of set off some alarm bells in your head of all of the niggles that you've just been leaving, comment below. Or maybe get in contact with us. We're very happy to maybe talk to you over Zoom if you're not happy of coming in, or we can see you face to face and kind of give you some advice on what might be going on. But yeah, I think it's just use the people around you. You've got the PTs in the gym. They're usually quite happy if you just say, can you just quickly check my technique? And yeah, do your warm-ups, do your stretching, do your load correctly, and it'll all be good.
And enjoy the gym as well.
Enjoy.
Perfect.